as Action Against AIDS Germany conducted these interviews in April 2022 for the preparation of our joint conference, Get Back on Track, the Global Fund's contribution to achieve the 2030 Sustainable Development Goals, that we organized prior to the Global Fund replenishment.
Our aim was to highlight the Global Fund's respect, contribution and support for community health systems as part of its approach towards health system strengthening. Thanks to Febi from Malawi,
Meirinda from Indonesia,
and Noliet from Rwanda.
My name is Meirinda Sebayang, but people used to call me May. I'm a mother of 3 lovely kids, and then I'm also the multi-drug resistant TB survivor. So yeah, I was diagnosed with TB drug resistant in 2006. So this horrible experience gave me enlightenment, I guess, because there's a lot of homework that we need to do, especially in Indonesia regarding TB. Because my experience when I was diagnosed with TB in 2006, it taught me that being ignorant, especially being Indonesians who ignorant of TB, is very dangerous, because we have latent TB, you know, in our body, in the society. I always heard that TB only affected those who are poor, those who lived in a rural area, in density area, and also TB only affect those who have a risk behavior. And also those who, we say the key population, which is the drug users, prisoners, and other the sub-populations who marginalize. The government provide services for the society, for the community who need the services. But then sometimes we forgot one fundamental issue here. It's about put the people at the center. It's about people-centered approach. I mean, if you talk about community system strengthening, so the community itself, they should have self-awareness. They should have adequate information. They should have access affordable medications. For me, the community system strengthening, we put the people at the center, we train them, improve their capacity, improve their knowledge, so they have this health-seeking behavior. They know what to do, they know where to go, and they also know how to spread the positive message within the community, so they can also protect the civil society. I believe that, of course, the government have goodwill, the commitment, but sometimes the commitment is only at the national level, but not followed by the provincial or local level. There is different level of commitment, of course, so that's why I say that the government have a good will, but they also need support from us, because sometimes they don't know they don't know what we really need is. Yeah, because sometimes they provide one menu for all, but of course different, because this is why I said that the people-centered approach. Everyone has their needs, everyone has the norms. They have their own mindset. So it's really good if the government also hear to the community and also follow the local wisdom. What I understand, Global Fund fill the gap around the area that the government cannot provide. For example, we have key population, right? People who use drugs, sex worker, transgender, and also men who have sex with men. And we also have another vulnerable populations, like people living with HIV and also got TB, and then also pregnant women who live with HIV, and also the prisoner, for example. So those are people, especially the queer populations, they been criminalized, stigma and discriminations, and sometimes because our cultural, our harm gender norms is become the barriers for them to access the services, the health services, access the public services. So Global Fund came, and then they said that civil society also can access the fund, that civil society also can fulfill their needs through the program. And there's a mechanism that has been built through the country coordinating mechanism that we call CCM. So now in Indonesia, the CCM Indonesia has representatives from the people living with disease, not only with HIV, but also the key population, and also people affected by TB and affected by malaria. So I mean, this platform mechanism is really a strategic platform because the community can speak directly to the government. The community also can speak directly to the religious leaders, to the UN agency, to other donors and other key players in the health issue. So this is a very good mechanism. However, the CCM mechanism is only at the national level. Once again, if we talk about a good program, it's not. We don't say it only at the national level, right? So it should be followed at the provincial, district level, maybe village level. CCM only at the national level. Civil society, of course, have a unique voice that sometimes cannot accommodate by the government at the country level. Yeah. So I think what we need here, that Germany's government to support the civil society, the community, to build their own capacity. Commitment. For me, commitment for the Germany government that will escalate the allocation for the 7 replenishment of the Global Fund, for example. I really hope that this sufficient funding will come, and then from there, the civil society and community will have more strong role, robust role, to have a negotiate power with our government at the country level. So, because civil society and community really depends on this Global Fund's partnership support, because it's really hard for us to get support at the country level, because the mechanism now is not really friendly for us. I would say thank you about their valuable contribution during these years to support HIV, TB, and malaria through this the Global Fund mechanism. I really sincerely acknowledge my gratitude for them, but then I know that we still have a homework. We need to get this global target in 2030. So that's why we need the Germany government commitment to support the 7th replenishment of the Global Fund so we can make the world better.